Hey there, my name is Dr. Cozy. It's really nice to meet you. And really quickly to get started, can I just have you confirm for me your name and date of birth? Perfect, okay. So we have you here because you experienced a pretty extreme allergic reaction. Okay. What were the allergy symptoms? Okay. But you were still able to breathe? Okay. Wow, okay. It lasted that long, okay. That's a long time. Do you have any known allergies? And what was happening when you first noticed the symptoms? For example, were you eating, using any new products? Okay, not sure, okay. Has anything like this happened before? First time, that's pretty scary. What was the first symptom you experienced? Okay, and the second? Okay, and how soon after the swelling started did you start seeing the hives? Okay. And are you still seeing some? Oh yeah, okay. So it's all over your chest, arms, okay. Alright. Well, we'll have to see if we can find a patch of skin that is not afflicted to help and diagnose what you were allergic to. First, however, I'm going to do an exam, okay? And this is standard because if in fact there is any residual swelling, anything that might be problematic, that might inhibit your ability to breathe normally, for example, we want to make sure that we identify that as soon as possible. So put on some gloves here. Sometimes when you sanitize your hands or have wet hands, the gloves tend to get stuck to wet spots. Okay. So first things first is I just want you to do your best to keep your eyes open, okay? So I'm just going to very quickly look at your eyes. Any changes in your vision at all? They're just kind of itchy. Okay. Grab it up here. Okay. I'm gonna use this applicator to kind of hold your eyelid up just lightly. Okay, and if you can look down. Great. Okay. And you can relax your eyes. And I turn that off prematurely. May I have you open your mouth for me? Thank you. Well, there is a little bit of redness in the back of your throat. It's probably residual irritation. Okay. And can you keep your mouth open, but just lift up your tongue? Okay. Alright. So the inside of your mouth is okay. There is that little bit of redness in your throat. So I'm going to palpate the external throat, okay? Just checking for swelling that I may not have been able to see on my internal exam. Not feeling anything concerning. Okay, just want to take a listen to your lungs. Okay, so if you can take a deep breath in for me, please. And out. Good. Again, deep breath in. And out. Again. Okay. I'm going to reach behind you just a little here. Again. Good. Again. Okay. And again, breathe in. Yes. And reach behind you. And last deep breath. Okay. All your lungs sound nice and clear, which is good. Okay. So I'm just going to be tapping on your chest. Just looks fine. Okay, I'm going to take a peek here at your skin and see if we can find an area that we can be able to use to do some allergy testing. It is an intradermal injection, meaning it's going to be an injection just right under the top layer of skin. Shouldn't be painful. These needles are really, really, really thin, so you most likely won't feel it at all. That being said, it may get a little bit itchy and irritating as the different allergens that we're injecting you with react or not. So just be aware, and we'll make sure that we keep you nice and comfortable. If that's the case, we do have some cold packs that we can use to help and alleviate some discomfort. And then if we do find anything positive, we will be prescribing you an EpiPen to use in the future, just in case, because you did have a pretty severe reaction. If we don't, then I will be referring you to a different allergist who will be able to conduct a wider spectrum of testing to see what exactly is going on, okay? Okay, so before we get to that, I'm just going to take a look at your skin here, okay? I'm going to take a look at your back. I do see that we have some usable real estate on your back that we can use to perform testing. So I'm going to draw up some syringes, okay? And then we'll get that going for you. Okay. I'll take this so we can document. Get us set up here. Put you there. Okay. Okay. So you're going to feel me untying your gown, okay? Yeah. I think we can just stay in this region here. So, first thing I'm going to do is just clean you off with an alcohol pad. Oops. Okay. Now I will be writing some numbers on your back, which we will remove from you before you go, okay? But need to make sure we know what we put where. Okay. So I'm going to begin. Okay. So I'm going to feel my needle kind of going under the skin, just like so. Okay. Did great. How was that? Told you, not too bad. halfway through, and you're doing great. Okay. Back to the side. That's getting full. And last one. Okay, so now we're just going to give those a few minutes to react, if at all. Okay, so now we're just going to wait for a few minutes while those react, if they react at all. So if you want to use your phone or anything, feel free, okay? I'm just going to write some notes. Okay. So I'm gonna go take a look, okay? good size reaction on number 8. So let's take a look here. Okay. Alright. Number 8 is something called methylisothiazolinone. So that is a preservative that is very frequently found in laundry detergent, and a lot of people actually are pretty allergic to it. Have you recently changed brands? Okay, so you've been using a natural one, but you found one on sale. I see. Okay. So I would suggest going back to that natural brand and avoiding any kind of exposure to this in the future. It will also be very important for you to read the ingredients on the label of whatever detergent or fabric softener that you use, okay? Okay. And I will be writing you that prescription for an EpiPen, just because sometimes we buy new clothes and things happen. So just in case, we will write that. In the meantime, as promised, let me clean off your back, and then I do have an ice pack here that we can hold on the spot. I imagine it's pretty itchy. Okay, we'll do that then. So let me just find alcohol. Oh, I knew I had another one. Okay, just activate this. Okay. And to start, I'm going to clean off that ink. So alright. So if this ends up being too cold, let me know, okay? Did that help at all? Okay, good. All right, so let's get this prescription going for you. So, okay, so you use the CVS on Main, correct? Okay. And you also have mail order? Okay, so we're going to start by calling this into that CVS, that physical brick and mortar CVS that you go into, and then you can transfer the prescription to your mail order. But just in case you have any reoccurring exposures within the next few days, I want to make sure you have this on hand, okay? Okay, so okay, so one of our nurses is going to come in here in just a few moments with some discharge paperwork, and she's also going to come in with a sample EpiPen. It doesn't have any medication in it or anything, but she's going to show you how to use it and then have you perform it yourself. So that way, in the event that you do need to use it for real, you'll be prepared and have the muscle memory of what you've done before, so you'll be able to react and act accordingly, okay? Okay. It's really important. She's also going to provide you with some material that's going to describe what to do if you do think that you've come into contact with something that you can do prophylactically before it escalates to the point of needing to use the pen. Okay? Okay. Yes, we have lots of educational material that we like to provide for our patients, so that way they are completely prepared for any event should it occur. And then I would like to see you back here in about 3 weeks for a follow-up appointment, just to see how you're doing and make sure that your symptoms have completely gone away. And I'm going to be giving you a call tomorrow to check in and see how you're doing as well. Do you have any questions for me? Okay. Well, if you think of anything, please feel free to give me a call, or we can discuss them when I call you tomorrow, okay? Okay. It was really nice to meet you, and you take care.